Hello everyone, welcome back to my channel. So today we'll be learning about case taking, that is from Aphorism 83 to 104. So this case taking topic is not just for academic purpose. It also helps us to improve our clinicals. So first let's study case taking. So when you write for exams case taking, you should or you must definitely study or by heart two definitions. And the first one is, what is a case? A case is not merely a maze of symptoms, but an instance of disease, an event, and a change in whole person from his original state of health to the present state of sickness. In short, it shows that it is the totality of alterations or changes in that human. So it comprises all expressions on mental, physical plane and on parts which logically form portrait of disease. So I suggest you to by heart this definition, and when you write this definition for exam presentation of paper, it will help you fetch more marks. So if you find this definition a little bit difficult, then you can study some other easy definitions that's available in your textbooks or anywhere else from your guide. So, but don't forget to write a definition of what is a case, and the second one is what is case taking. So a well taken case is half cured, so said by Elizabeth Wright, isn't it? So let's study what is case taking. A case taking is a unique art of getting a conversation, observation and collecting information from patient as well as from the bystanders to define patient as a person and diagnose the disease. This definition is easy, isn't it? That conversation, observation and collecting information, that will be really funny to study too. So I suggest you to by heart this and see for yourself by fetching more marks. So that's all. Now let's move to case taking Aphorism 83 to 104. So first aphorism is Aphorism 83, requisites of a physician in investigation a case. So every case of a disease should be individualized, isn't it? So for that, what are the requirements or requisites or must-haves a physician should have when investigating a case? First one is freedom from prejudice. The physician must be or should be free from prejudice. Why? Because he should not think that person is pulsatilla. He shouldn't think that the person is naxphomicate just by 2 or 3 symptoms. Instead, he should study the case as a whole, find the totality, and then only he should understand which remedy comes. So for that, he should be free from prejudice. Then he should use all sound senses. For what? For attention in observing. So he should observe signs and symptoms and by using his sound senses. And the last one is fidelity, that is faithfulness. He should be faithful. So these are the requisites, that is must-haves of a physician investigating a case. And next is Aphorism 84, that is sources of case recording and instructions for case taking. So what are the sources? From where we'll get the source of case? The first person is patient narration. The patient should narrate his symptoms, and then we will get symptoms from the bystanders, and we'll get the signs from physicians by direct observation. So these are the 3 sources that help us to record a case. And the must instruction, the very important instruction for case taking is, when the patient is speaking, we shouldn't interrupt. Don't interrupt the patient while he is speaking. The physician should be patient enough to hear what patient speaks. Patient to a patient. So don't interrupt the patient while he is speaking. So next is Aphorism 85, just one single line is there. Fresh line for every symptom. That's important. Aphorism 85 says fresh line for every symptom. We shouldn't just save papers or anything like that. Just fresh line for every symptom. Then Aphorism 86 shows eliciting more precise information. So when the patient have finished their narration, we shouldn't interrupt, isn't it? Okay. When the patient have finished the narration, the physician should read over the symptom one by one and inquire further particulars about each of them. So the patient is saying, I am having headache in the morning. I am having headache in the frontal region, and it's been 2 days. And I also have knee pain. So we are writing one by one and later we are reading those symptoms one by one. So we got headache, okay, morning, 2 days, okay. Now we are getting questions on our head. The physicians are getting questions in the head, like when does that headache worse? So we will add it. We will ask the patient and we will add it. Likewise, when we are writing a fresh line for every symptom, when we are writing like that, we will get the idea, we will get more precise questions. So in aphorism 86, we elicit more precise information. And next one is aphorism 87. Aphorism 87 shows no leading question should be asked to the patient. Yes or no questions should not be asked. Physician should never frame yes or no questions like for example, you have headache in the morning, right? Okay, yes. Like instead of that, when do you have headache? Can you repeat it? When did you have headache? Like that. We should not frame. We should not give the patient's answer to be yes or no. Instead, the patient should say which, when, where by himself or herself. We should not frame it. So aphorism 88 shows ask about the neglected questions and use general expressions. So we must inquire about affections of physical and mental general. So after these physical symptoms or mental generals like appetite, thirst, stool, urine, sleep, etc., whether it has been rearranged or not in physical, and mental generals like manner, memory, habit, dispositions, whether rearranged or not. So these things should not be neglected. These questions should never be neglected. If a patient is okay, then all these appetite, thirst, stool, urine, sleep, everything will be all right. If the patient's body is deranged, at least one general will be deranged. Sometimes it will be sleep, sometimes it will be urine, stool, motion, then appetite, or thirst, something will be deranged. So we must never neglect question. So 87 deals with no leading questions, 88 never neglect questions. So 89 is freedom to ask more precise questions. So in 86 we learned eliciting more precise information, and 87, 80, again 89 freedom to ask more precise questions. I don't know why this aphorism says, but okay, to get more points and marks we are writing freedom to ask more precise questions. Means if a physician feels that he has not yet gained complete information, he is in liberty to ask more precise questions as per needed. Okay, so more precise questions. 89, 86, that 9, if it is opposite, it is 86, more precise questions. If it is opposite, then 89, freedom to more precise questions. 86, 89, like that you remember. Okay, then 90, physician's observation. The trick is 90, P and O, physician's observation. So finally, physician himself must note what he observes in a patient, like behavior, facial expression, complexion, tongue, mouth, pupillary reflex, drowsiness, hasty speech, etc., etc. These things must be observed by the physician. Other than this, he can look for general pallor, cyanosis, edema, lymphadenopathy. All those things can be found by physical examination. And for example, red triangle tip of tongue for Oxtox. This can lead to prejudice, but I just gave an example for understanding what is physician's observation. Okay. Then 91, eliciting the original form of disease plus give a placebo. The physician must consider only the symptoms and ailments of the patient which were present before the use of allopathic medicine. Thereby, we will get the true fundamental ideas of the original form of disease. Why? So, for example, the patient is having headache, aggravation morning, aggravation when drinking cold coffee, cold drinks, ameliorated hot coffee, but he took some kind of allopathic medicine, and all those symptoms like after eating drinking hot coffee, all those symptoms went. So that is not the original form of disease, that is suppressed form, isn't it? So we should not take those symptoms. Instead, we should consider only the symptoms and ailments of the patient which were present before the use of allopathic medicine. But in chronic disease, if the patient is under allopathic medicine, then the patient must be allowed to discontinue the medicine for several days. And in the meantime, we must prescribe an unmedicated substance to satisfy the patient, and it is called placebo. So that is what called as placebo. So the patient will be thinking, oh, I just went to that homeopath. That physician is not giving me any medicine. I don't think he is a right physician. He's not giving me. Then how I should get relief or get cure? So in order to avoid that, we are giving a placebo such a way that it will not only satisfy the patient but also help us to cure the patient as quick as possible by not giving unnecessary medicine. Because time heals, isn't it? It needs some time to heal from that allopathic side effects or whatever it is. So we're giving some time. For that time only we are giving placebo. So 91, give placebo, eliciting the original form of disease. Then 92 is conjoined malady. So what is conjoined malady? The medicinal disease, that is allopathy, plus original disease is equals to conjoined malady. Malady means a disease, conjoined means both, to conjoined. So medicinal disease, allopathy plus original disease. You might have thought that in many places allopathy is being criticized. Or why it's so? It's because Samuel Hahnemann was first studied allopathy, and later only he understood during that time leeching, cupping, all those kind of brutal kinds of treatments were given, and he was not pleased with those treatments. That's why he mainly used those old school medicine as an enemy or whatsoever. So that's why here medicinal disease means allopathy plus original disease is equal to conjoined malady, and further other treatments only he knows what he has mainly thought to convey to us. So but in this aphorism 92, conjoined malady, but in cases of acute emergencies where the patient is in need of quick relief, we have to prescribe medicines rather than placebo by suiting the totality of symptoms of both natural and artificial disease. So previous aphorism I told, okay, we have to wait for that to satisfy patient, you should give placebo. But in some acute emergency cases, if you are just giving placebo, then the patient will be mad, okay, the patient will be really angry with us. Because why? In need of quick relief and to save the patient, we have to prescribe a medicine rather than placebo by taking all the totality of the symptoms of both natural plus artificial, that is allopathic disease, the symptoms produced by allopathic medicine. So only in cases of acute emergency, okay, you should keep in mind, only in case of acute emergency. Here it was chronic disease, here it is acute emergency. So next is 93, aphorism 93, secret questions. Special questions for special things. Some cases which results from causes of disgraceful character which a patient doesn't like or don't like to confess voluntarily, like onanism, like masturbation, extramarital affairs, love failures or grief, or etc. etc. These need careful investigation by skillfully framing questions and get personal information. Because the patient, for example, these symptoms also will help us to diagnose the disease plus give correct remedies by understanding the personality of the patient and so and so. So that is aphorism 93, secret questions, like special questions for special things. SSS, remember like that, SSS, secret questions, special questions for special things. Aphorism 94 deals with obstacles preventing cure has to be elicited, like occupation, diet. If anything such as occupation, mode of living, lifestyle, diet, and any other situation that becomes a maintaining or fundamental cause of a disease that stands as an obstacle must be removed. That's sure, must be removed. Obstacles must be removed. So in this obstacles footnote, aphorism 94 obstacles, and then there is a footnote that is very important, that is female case taken. For female patients, we must inquire about their pregnancy, their history of pregnancy or sterility, suckling, menstrual discharge, or any other discharges. We should understand female case taking, and this footnote is very important, keep it in mind. Aphorism 95, it's very important, lesser accessory symptoms. So it will be asked, okay, in chronic diseases, some symptoms might be neglected by the patient as they are used to it. It might be their daily routine and might have forgotten the symptoms. But that kind of symptom may help the physician to select symptom. So there are some symptoms like he used to have bleeding gums, okay, while he is brushing the teeth, for example. And every day he used to see gums bleeding, and that on those days he thought that's important, but late after seeing every day he thought that, oh, my gums are so soft and sensitive, that's why I usually bleed my gums. So he will forget that, he will think it's a habit and he will forget that. But that's really important. It might show a vitamin C deficiency, but he might, or he fails to say that to the physician. So these less necessary symptoms means the patient will forget it because of their daily routine or neglected by the patient and give it less importance. That is lesser accessory symptoms. Aphorism 95. So aphorism 96 and 97, you should keep in mind 96 and 97. 96 is hypochondriacs and 97 is indolent persons, both opposites, extremes. 96 is hypochondriacs. Such hypersensitive patients are impatient of their suffering and describe their symptoms in exaggerating expression. He will be having just a wound, just a small pinpoint wound, but he will be saying, oh, it's so bleeding, I cannot, it's so painful, I cannot sleep, it's so sore, like that. He will be exaggerating the symptom. So we should keep in mind. So when you see such patients, you should keep in mind, oh, he's an hypochondriac. 95% it will be, nothing will be there. 5% only will be the real ailment. So you should keep in mind. And there are some patients like indolent persons who are very lazy patients. They are lazy to even say the symptom. They don't mention all the symptoms. They claim some symptoms are of little importance. So these are the extremes, 96 and 97. Then comes 98. It is better to get symptom from the patient than from his friend or bystander. Why? This is because sometimes bystanders gives false information. So first of all, trust the patient as a whole, and you will get the symptoms from bystanders, but you should use your common sense by understanding which is what is right for you, what you feel it is right, that you should keep in mind. 99 is investigation of acute disease. It is easy for a physician to treat an acute disease because why? 1. All the derangement of health due to recent event is fresh in patient's memory. That is a key point. 2. They still continue to be novel and striking. Will be so novel and striking. 3. There is no need for asking more and more questions, as patient will give all the details to physician spontaneously. So it is really easy, isn't it? Acute disease is really easy, but believe me, for the patients will be coming for chronic disease. Mostly the patients will be coming for chronic disease for treating. So they will be going to they will suppress all those conditions and ailments, and they will come as a chronic disease. Then next is aphorism 100. Consider each case as new and unknown, like new everything. We must consider every epidemic disease or any other disease as individual one, and must select the medicine according to the current true picture of disease and not previous totality. Aphorism 101 says constructing totality in epidemic disease. So first we should consider new and unknown case. Second, 101, construct totality in epidemic disease. So we must examine the patient with particular disease and find common symptoms to get the complete picture of epidemic disease. So first we should consider the case as new and unknown, and in aphorism 1 it says we should construct totality in epidemic disease, and in aphorism 2 it is genus epidemicus, the very important question. So after finding the totality, what? To find the true picture of epidemic disease, we have to write down signs and symptoms collected from all those cases affected by it. After noting all those symptoms, we have to elicit the prominent and peculiar symptoms of the disease. So to select a specific remedy for disease, we should collect all its peculiar signs and symptoms from several patients who are affected by it. The medicine that covers the totality of symptoms of epidemic disease is called genus epidemicus. I repeat, the medicine that covers the totality of symptoms of an epidemic disease is called genus epidemicus. I will give you an example. When COVID came, ourselves was given as a genus epidemicus. Why? Because when COVID came, many physicians, or for example, one physician has collected 5 patients totality, and from that 5 totality from the patients, the most important peculiar signs and symptoms from that 5 patients who was affected from COVID was noted down. And after studying that, the physician understood that it is the arsenic album is the remedy that has all these symptoms, and thus R-salb became the genus epidemicus of COVID. So when you think about 1 or 2, think about COVID and genus epidemicus, and you will write it as. Then aphorism 103, investigation of SORA. SORA causes chronic disease, isn't it? We must investigate chronic disease and nature of the SORA like we did an investigation to acute disease and epidemic disease. So we should study SORA too. We should study chronic disease also. In aphorism 104, the importance of record keeping. So we took all these cases, we followed all these regulations, rules, everything. And now what we have to do? We have to record keep. The case records, we should keep it safe. Why? To evaluate symptoms and the case. Second, to give follow-ups. We should write follow-up, strike the relief symptoms, add new symptoms. And lastly, for future reference and case taking, again the patient will come, where we will write. We will keep, or record keeping is important because it will help us for future reference and for future case taking. So that's all about aphorism 83 to 104 case taking. That's all. Thanks for watching, and if you like this video, please like, share and subscribe. And if you have any doubt or suggestions for next topic, please comment below. Hope you like it. Thank you.